Good afternoon, Representative Hunt. My name is Courtney Rosenthal, and I am a bedside nurse and clinical nurse educator in a surgical trauma intensive care unit with Atrium Health in Charlotte, North Carolina. I am so grateful to have this opportunity to speak with you today about a subject in which I am very passionate, and that is that violence against healthcare workers has gone unchecked for too long. So I work in this unit, and each morning we begin our shift with a huddle. And in that huddle, we have a safety check-in for pertinent safety concerns for the staff. Over the course of the last month, I have heard of nurses being kicked, spit on, bitten, and one punched so hard she had a black eye. So some of these situations can be chalked up as accidental, or the patient didn't know any better, or maybe they were dealing with a head injury that affected their judgment, or a metabolic process that made them encephalopathic. But some of these, in fact, many of these instances were knowing and malicious and intentional violence against healthcare workers. Workers who were just trying to do their job. So in a society where healthcare is a consumer commodity, it can feel like the rights of patients overtake the rights of the healthcare providers who are attending to them. I want to read you a passage from a message I received from a nurse who was the recipient of the black eye from a patient. She said, "I've got a pretty nasty welt, but I'm all right. I left my shift frustrated because the nurse in me, the empathetic person in me, wants to understand that even though he did know what he was doing and had a choice, at the same time, his injuries really prevent him from controlling his impulses and understanding wrong versus right and action versus consequence. But then there's this little part of me that's like, but wait, I'm a person, a real person. And no other profession in the world has to worry about getting hit and whether it's justifiable or not. We have to find a way to effectively enforce prosecution of individuals who use violence knowingly and willingly against healthcare workers. We know there's a nursing shortage. There are very high levels of turnover, and there are profound levels of nursing burnout. All of these things are potentiated by nurses coming to work with a literal threat to their safety. The National Institute for Occupational Safety and Health classifies workplace violence into these 4 basic categories. In type 1, you're talking about criminal intent against healthcare workers. But in type 2, this is talking about customers, or in our case, patients, who become violent while receiving services. North Carolina has not found a good way to address this category of violence. So in 2015, House Bill 560 was passed, which makes it a felony to assault any hospital worker or licensed provider while on hospital property. I think this is excellent. Prior to the passage of this bill, the only people who were protected in their practice were those who worked in the emergency department. So as someone who does not work in the emergency department, but is still on the receiving end of violence from patients, I think that the language of this bill is excellent. However, what this bill doesn't address are the support systems that have to be in place to enforce the bill. In your capacity at the Judicial Committee, I believe that you can help to educate those in the state judicial system regarding the importance and enforcement of House Bill 560. The safety of me, my friend Ashley, and all healthcare workers is at stake. The North Carolina Nurses Association and nurses all over the state are relying on representatives like yourself to fight on our behalf. Won't you stand up for those of us who tend to the most vulnerable part of our population? I look forward to seeing your advocacy and dedication to this topic. Let's stop violence against healthcare workers together. Thank you.